you do the best that you can, because you'll form a more holistic overview of the perspectives that you're supposed to have for the interview. So yeah, thank you very much.
Okay, so hello everyone. Can you hear me all right?
Yes.
Okay. Okay, hello everyone. So today we're going to be talking about the foundation of medical ethics. Next slide, please. So please feel free to take any screenshots of any slides to refer back to them later, or you could watch our seminar recordings on YouTube just to make sure we're taking a lot of the reflection going on. Okay. Next slide, please. Right, so how to use these seminars on ethics effectively to ensure you can get the most out of it. So to get the most out of it, we're going to be needing a lot of reflection, and this session on ethics will help you form an understanding of common medical ethics principles, which will help you prepare for your interviews for like medicine. And these seminars also help you knowing about the principles to learn what medicine in the UK is based on in terms of ethics. So some top tips are to get the most of this session, make sure you jot down notes and get your own perspectives of the situations that we'll be talking about. Um, having an opinion about something and knowing how to explain it is crucial for our interviews. So be interactive in the chat. It can help you learn more from what other people have to say because everyone has different perspectives, and it can also help to consolidate your own perspectives. We have put question cues in our slides, so use them to form your perspectives, and please be proactive. Next slide, please. Okay, so how to use the seminars on ethics effectively again to ensure you get the most out of it. Some more tips is it's important to form an overall understanding of the medical principles that we will be talking about, because if you're given a scenario in the interview and asked what you would do in that situation, it's best if you can actually base it on an ethical principle that the NHS abides by. So it shows you're thinking like a medical professional already. And evidently, it is important to learn how to use the ethical principles in your arguments in a structured way. And most importantly, you need to be able to give a holistic view of what possibilities arise from the ethical principles you have considered. Next. So, how you should structure your answers to ethical questions that you're given in interviews. So, make sure you acknowledge the dilemma. Start by showing you understand the conflict. Something you could say is like, this is a complex situation because it involves a conflict between dot dot dot. Identify key ethical principles. This helps you show awareness of these ethical principles. And something you could say is this involves autonomy, as the patient has the right to choose, but also non-maleficence, as doctors must avoid harm. Dot dot dot. Sorry about that. Make sure you explore both sides. Do not be one-sided. You need to show the pros and cons, the patient versus doctor perspectives, and the short-term versus long-term impacts. Like an example will be on one hand this, and however on the other hand this. Next slide, please. Okay, then you should consider context. Bring in real world factors like capacity and consent, patient safety, guidelines slash professional responsibility, multidisciplinary input. Something you could say can be like, in practice, doctors would also consider dot dot dot. But make sure you give a balanced judgment. You must conclude but not in an extreme way. Something you could say would be like, overall, I think this, but this would depend on this. Make sure you avoid absolute answers and overconfidence because that could weaken your answer. And make sure you end with reflection. Like ultimately, it highlights how important it is for doctors to balance patient autonomy with safety. Slide, please. Okay, so key things interviewers will be looking for. They will be looking for balanced thinking, clear structure, calm reasoning, no extreme opinions, and awareness of real world medicine and how ethical principles play in the real world. And then some common mistakes we want to avoid during our interviews is being too one sided, saying it depends without explaining, that's a bit vague, ignoring patient perspective, forgetting safety, trying to be over technical. You're not expected to know the ins and outs of medical ethics thoroughly yet, just a basic understanding, which this session provides. Okay, so the four pillars of medical ethics. The four pillars of medical ethics are the framework for healthcare professionals to prioritize well-being, dignity, and trust. It also protects patients and professionals. It is used across the NHS for ethical decision making. So the first one is autonomy. This is the right of patients with capacity to make informed voluntary decisions about their own healthcare, even if those decisions conflict with medical advice. Patients have the right to make their own decisions, and patients need to give informed consent. And autonomy also gives patients the respect for their own decisions and values. Second one is beneficence. Beneficence is the moral obligation of healthcare professionals to act in the best interest of the patient, actively promoting their own welfare and well-being. Beneficence involves acting in the patient's best interests, providing care to improve health, reduce suffering, and benefit the patient. And it can also sometimes conflict with autonomy. Next slide, please. And then the third one is non-maleficence. It obligates healthcare professionals to avoid causing unnecessary harm, injury, or pain to patients. It involves covering physical, mental, and emotional damage. It helps to avoid causing unnecessary harm or suffering, risks versus benefits. In trying to do good, don't cause excessive harm. And then the last one is justice. Justice represents fairness, equity, and impartiality in medical decisions, ensuring equal access to care based on clinical need rather than wealth, background, or social status. Justice ensures that resources are distributed fairly, patients cannot be discriminated against, and it helps to maintain public trust. The UK framework. Next slide, please. So first we have the role of the General Medical Council, the GMC. The GMC is the independent regulator for doctors in the UK. Licensing. All practicing doctors must be registered and hold the license to practice. The GMC can suspend or remove doctors from the register. It also sets standards. Good medical practice, the core ethical framework for all UK doctors, and outcomes for graduate standards for medical schools. Revalidation. Since 2012, doctors must revalidate every 5 years by demonstrating they meet current standards through appraisals, and also the fitness to practice. The GMC investigates concerns about doctors' conduct, health, or performance. NHS structure and public accountability. So the DHSC, the Department of Health and Social Care, it sets overall policy. The Secretary of State is ultimately accountable to Parliament. Then we have NHS England. It oversees commissioning and delivery of NHS services nationally. Then we have the Integrated Care Boards, ICBs. Since 2022, replaced clinical commissioning groups responsible for planning health services in local areas. And then we have the NHS trusts slash foundation trusts. They deliver hospital and community services. Foundation trusts have greater financial autonomy. Foundation trusts are also accountable to their own local members slash governors. And then we have the CQC, which is the Care Quality Commission. It is an independent regulator inspecting safety and quality of care. Then we have the Mental Capacity Act from 2005. The MCA governs decision making for people in England and Wales who may lack capacity. In medical ethics, capacity refers to the ability of an individual to make decisions about their own medical treatment. It is a legal and ethical consideration that ensures that healthcare decisions are made with the patient's consent, which is presumed unless there is evidence to the contrary. We have 5 key principles from the Mental Capacity Act. Number 1 is presume capacity unless established otherwise. Second is support people to make their own decisions. Third is unwise decisions does not mean lacking capacity. Fourth, thank you. Fourth is the act in the best interests. Any act slash decision must be in the person's best interests. Fifth, the least restrictive option. They also carry out 2-stage capacity tests. Does the person have an impairment slash disturbance of mind or brain? Or does this cause inability? And does this cause inability to understand, retain, weigh, or communicate a decision? Gillick competence under 16 consent. A child under 16 can consent to medical treatment without parental involvement if they have sufficient understanding and intelligence to understand fully what is proposed. The Fraser Guidelines, often used interchangeably but technically specific to contraception. A checklist is a checklist for practitioners assessing whether to provide contraceptive advice/treatment without parental consent. Refusal of treatment is more complex. Courts and parents can override a Gillick competent minor's refusal in serious cases. Parental consent remains valid even if a child is Gillick competent. Consent from either suffices. Over 16s covered by the is covered by the MCA, which is stated in the Family Law Reform Act from 1969, as they are presumed to have capacity. And then we have the 7 guiding principles. And comprehensive service. Comprehensive service covers a wide range of health services, including prevention, treatment, and rehabilitation for everyone. Access based on needs. People receive care based on medical need, not their ability to pay. Patient centered approach. Patients are involved in decisions about their care and treated with respect and dignity. Equality and fairness. Everyone is treated equally with efforts to reduce health inequalities. Efficient use of resources. Money and resources are used wisely to provide the best possible care. Accountable to the public. Services are transparent and responsible to patients and the wider community. And then the high standard of care. Care should be safe, effective, and continuously improving.
Okay, thank you, Precious. I will now be taking over from this section where we're going to look more into ethical concerns that is regarding cosmetic surgery. So, we're going to go more into a specific issue and discuss the various ethical concerns that exist surrounding cosmetic surgery. So, firstly, let's define what cosmetic surgery is. Cosmetic surgery is defined as a range of surgical procedures that are carried out to enhance and alter a patient's physical appearance. Now, we need to differ this from reconstructive surgery because both cosmetic and reconstructive surgery come under the category of plastic surgery, which most of you may have heard of. Reconstructive surgery mainly talks about patients who may have undergone trauma, who may have undergone accidents, or patients who may be born with congenital conditions, like, for example, cleft lip or palate lips. And for these particular conditions, it's essential that a patient undergoes reconstructive surgery in order to repair the damage they may have on their body or in order to ensure that they can have normal facial features, for example. But cosmetic surgery differs widely from reconstructive surgery because these surgical procedures, as we will see later on, are usually done to enhance a person's body features, their physical features, and is done by the patient themselves. So it's the patient's choice to undergo the surgery. This kind of surgery has no medical relevance and it's not medically necessary for anyone to undergo cosmetic surgery, whereas reconstructive surgery, on the other hand, is usually done for patients who may be in a life-threatening condition or may have certain genetic conditions which may require them to undergo that form of surgery. Now, you may be wondering, if cosmetic surgery is not necessary, then why do patients usually undergo the surgery? Well, the three main reasons that people get work done is firstly, they try to boost their confidence or self-esteem. Now, since cosmetic surgery involves patients enhancing their physical features, certain people, for example, might be influenced by what they see on social media. They might want to look a certain way. They might want to improve a feature that they don't like of theirs. Like, for example, we have rhinoplasty, which is used to improve a person's nose, change the shape of a person's nose. We have lip fillers, we have cheek fillers, we have Botox, and all these different kinds of. We have breast augmentation, for example, liposuction surgeries, which involves removal of fat so that a person can lose body fat. All these kind of surgeries are done by people who might want to improve a particular physical trait. So they want to augment their breast size, maybe they want to lose weight, they want to look healthy. So these are reasons that can help a person improve their confidence and self-esteem, or it could also be a response to social or cultural pressures. So as we all know, on social media these days, there are very high expectations surrounding beauty, surrounding looks, and so lots of teenagers, especially, might be very much influenced by these very high expectations that are placed upon appearance, upon looks, and also a lot of different discrimination that occurs around skin color, for example, or around the stigma surrounding body weight, for example. So these different social and cultural pressures, for example, the tendency for people to prefer fair skin over darker skin, or the preference to favor thin people over people who have a larger body weight, all of these can influence a person's mental health or decision and thus could provoke them into undergoing surgery or even aging because social media does emphasize the fact that people who are older, people who tend to have wrinkles, for example, people who look older are criticized for the way they look. And so everyone wants to look younger these days, although aging is not talked about often as being a natural process. And all of these different factors, which are not talked about often, are what influence a lot of people to undergo these kinds of surgery. So now we'll get a look at the actual ethical concerns that surround cosmetic surgery. And the first one, which is one of the pillars of medical ethics, is when we talk about autonomy, which is the freedom of a patient to choose to undergo cosmetic surgery. Well, although we do say that it is often a choice of the patient, it's the patient who consents to these forms of surgery. Sometimes it is not always the patient's decision to want to undergo this kind of surgery because, like I mentioned earlier, social media can portray very unrealistic beauty expectations. It can promote certain beauty standards which otherwise shouldn't be promoted, and this can encourage, especially teenagers, to feel that they have to follow a certain appearance, follow a certain standard of looking. And so, as you can see in this picture, for example, filters are one of the things that a lot of teenagers use nowadays, a lot of people often use on social media, online. And these beauty pressures, these beauty standards can have a very negative psychological impact on people because the anxiety that is associated with these pressures to conform to these beauty standards, these ideals can negatively impact mental health. And often, as we said earlier about social pressures, cultural pressures, all of these can push a person towards undergoing surgery. And sometimes some people don't even choose to go through the surgery, but are often forced to because maybe their friends or family want them to go through it. So it's not always their choice as well. Another very important concern actually is about informed consent, which, as we know, is a very important part of the doctor patient dynamic because it's really important not just with cosmetic surgery, but with any surgery that the patient understand the risks associated with the kind of surgery, the limitations of the procedure, as well as the realistic outcomes it can undergo. That result from the surgery. And one of the major disadvantages of cosmetic surgery is that teenagers often come in with very unrealistic expectations of what they wish to result from the surgery based on what they see on social media. And so it's really important to address to the patient that the surgery may not address all of their expectations because there are a lot of side effects that can result from surgery, and not all of these surgeries result in perfect features. Some of them might not result in symmetric features. Some of them may not turn out the way patients expect them to turn out. And so it's really important that these outcomes are addressed in order to ensure the patient's aware of the realistic outcomes because some of the major issues, as mentioned here, are unrealistic expectations based on what teenagers and people see on social media. Some surgeons might even tend to oversell their results by basically convincing them to undergo the surgery, and they portray the wrong version of what would actually result. And as a result, more people are provoked to go through this. And this is not a good thing because it's really important that patients are fully aware of what the surgery will result in. And as I said earlier, a lack of full understanding of expectations, because it's really important that patients make clear what their expectations of the surgery are, because cosmetic surgery is not for everyone. And it's very important that the doctor, the surgeon, gets a good idea of what expectations the patient actually has in order to ensure if the surgery is right for the patient. Because as a question here says, can consent be valid if expectations are unrealistic, if the patient themselves expect something which cannot occur from the surgery? How do we conclude that they do consent to the surgery if the surgery itself does not result in what they want? So it's very complex, but it's very important to address the fact that it should be made clear what the patient's expectations are. Because, for example, a patient who might want to fix a specific feature about themselves, or a patient who might want to fix their body weight, for example, or the patient is fine with themselves, but there might be one feature about them that they think could be made better, like maybe something about their nose, for example. And so these kinds of patients have realistic expectations, but there are some patients who want to have a certain look, who want to look like a particular famous person, for example. And so it's very important that these expectations are addressed first. And as we will see later on as well, there are some psychological impacts that are involved here as well. But before we get into that, it's also important to address beneficence versus non-maleficence, which was also covered during the 4 pillars of medical ethics. Beneficence involves improving confidence, as the name suggests. And a good thing about cosmetic surgery is that it can improve the mental health of the patient. If the patient has a better facial feature, it might enhance their well-being, it might enhance how they feel, it could have a good impact on their mental health, and overall, this has a good impact on the patient. So this is a good reason for why they should be allowed to undergo cosmetic surgery. But non-maleficence talks about avoiding harm. That is, the patient shouldn't, we should try to avoid as much harm as we can. But as I mentioned when we started this section, is that cosmetic surgery is not medically necessary most of the time. Unlike reconstructive surgery, cosmetic surgery is often done out of choice. It is not advised to a patient, it's the patient who makes the decision to undergo this kind of surgery. But at the end of the day, all kinds of surgery carry risks. They could result in infections, complications, dissatisfaction. And so, if we're talking about non-maleficence, which is avoiding harm, it's very important to make clear the fact that these kinds of procedures can carry risk to the patient and may not always result in a good outcome. So there are two important things that we're talking about here. It's a risky procedure, as well as it's not a medically relevant procedure. It has no medical effect on the patient. It's not going to be necessary for the patient. It's just the patient's decision to go through it. So should doctors be performing these kinds of procedures that have risks to the patient and are not medically needed? We talked about autonomy, and now we're talking about this. So we're balancing two different things here. And another major ethical concern is about body image and mental health, which is also linked to beneficence. Some patients might have low self-esteem about maybe the way they look. They might have body dysmorphia, so they're not happy with the way their body is. If possibly they might have a very low body weight, a very high body weight, or they might have experienced bullying with respect to the way they look. And so this has a very negative impact on their mental health. And so, as we saw in the previous slide, undergoing cosmetic surgery could allow those patients to feel better about themselves, but sometimes these might have a deeper root and might involve maybe a mental health disorder, or maybe the patient is undergoing a psychological issue, is undergoing emotional turmoil, and maybe this is not actually linked to the way they look, but maybe could just be linked to something the patient is feeling mentally. So, for example, research has suggested that some patients just want to undergo cosmetic surgery because maybe they want to repair a relationship, a damaged relationship. Maybe they're not feeling emotionally well, or maybe they're trying to fix a relationship that is unstable. And so these concerns are not linked more to the way they look, but are linked to actually more psychological reasons. And so another important question that arises is, should we perform surgery if the major issue is more mental, associated with their psychological parts? So that's another major ethical concern. Another important thing to talk about is, as I said earlier, age and vulnerability, because it's especially teenagers that are very much prone to undergoing and feeling these kinds of things, because it's during this particular age and period in time where forming their identity and social pressure can heavily influence what a young person feels. It makes them more vulnerable to feeling bad about themselves, feeling bad about the way they look. And so it's very important to address these concerns as well, because although a patient might feel better about themselves once they undergo cosmetic surgery, this could just create further inequalities. Like, for example, feeling bad about skin color and allowing a patient to maybe change their skin color could just worsen inequalities with regards to skin color. So maybe the root cause is addressing these inequalities rather than letting people just undergo surgery for this so that people don't actually have to do the surgery. And another thing is also about commercialization of medicine. So a lot of clinics, as we saw earlier with surgeons overselling surgeries, clinics can also aggressively advertise these kinds of medicine, and this could target vulnerable populations like teenagers and those age groups. So, another good thing that you can think about is, does profit conflict with patient well being? And here's another set of questions as well. Do you think that there should be stricter age limits of who can undergo cosmetic surgery and who shouldn't be able to? And do you also think that young people can truly give informed consent for this kind of surgery? Because as we had covered earlier, getting competence above a certain age, young people can give consent without their parents needing to be present. So have a think about this. And the last thing that we will see here with regards to ethical concerns is about equity and access, so justice, which is another pillar of medical ethics. Cosmetic surgery is actually quite expensive, and there is very much unequal access to patients for this kind of surgery. But the fact that it is expensive means that lots of money often goes into this kind of surgery, and public healthcare resources are limited. So should we really be spending funds and money for this kind of surgery when, as we already said, it's not a medically relevant surgery, it's not necessary for any patient, and it does not have any medical relevance. So, do you think we should actually be using healthcare resources? Should we continue to do so for cosmetic procedures? Is another good thing to think about. Then, when we talk about culture and social impact, as I already said earlier, for example, as I took an example of skin color by allowing patients to maybe want to become fair, to make themselves look whiter, maybe have fair skin. This is just further deepening the inequality that already exists between darker and lighter skin colors and just further promotes racial discrimination. And so this just reinforces these beauty standards rather than making them better. And so does cosmetic surgery contribute to harmful societal norms? Is it just making things worse than any better? This is also another good thing to have a think about. As I was saying earlier, the same point here as well, it reinforces inequality. So, like I said, some procedures can promote ideas like if you look younger, it's better. So, for people who are aging, they might want to make themselves look younger, remove wrinkles, for example, and just try not to age anymore. Try to look younger for their age, or even the idea that lighter, fair skin is better. This can just support unfair standards that are related to gender, to race, disability, rather than challenging them, which is what we should be doing at a public health level. And so this is why one of the reasons why cosmetic surgery can actually be more harmful than a good thing. And as we said, some of the vulnerable groups of people are teenagers who are very sensitive and vulnerable and highly exposed to these kinds of peer pressures. And it's around this age that they build their sense of identity. So it's really crucial to point out that these kinds of beauty standards, unrealistic beauty standards, societal pressures can have a very large influence on teenagers, which could further make them want to undergo plastic surgery. And so it's again very important to address this point as well. And one of a further disadvantage of this cosmetic industry is that by promoting these kinds of unrealistic beauty standards, they are deepening these insecurities that teenagers have about their appearance by marketing these procedures as solutions. So, for example, rhinoplasty is surgery to make your nose look better. These kinds of surgeries are marketed and promoted as maybe a solution to make a facial feature look better. And by doing these kinds of marketing techniques, it just further worsens the insecurities that teenagers face. So this is not a good thing at all. And the other major disadvantage about it is by undergoing all these cosmetic surgeries, individuals can become more addicted and more prone to just going through surgery after surgery in order to just keep looking better. Maybe because they are dissatisfied with the outcome of a surgery, they might feel more inclined towards getting another surgery. And this is especially actually linked to body dysmorphia, which, as we saw earlier, is a person where a person is overly concerned and obsessed with the way they look, their physical appearance. So even the tiniest flaw can make them want to undergo even further surgery. And this is not a good thing at all. Surgeon responsibility is also, as we said, very important to make sure that the root issue is not a mental health issue, because if it was a mental health issue, then maybe that would need to be addressed first. So it's very important for every surgeon as their duty to screen for mental health issues to make sure that a psychological reason is not cause of why the patient wants to do this, because otherwise then the patient could be referred to a psychiatrist maybe to understand why they feel the way they're feeling. It's important to manage expectations and complications, so addressing the risks of the surgery, because this kind of surgery comes with multiple risks and side effects in the long term. Expectations, as well as we already talked about, what the patient's expectations are, whether they are realistic enough, whether the patient is suitable to undergo this kind of surgery, or whether their expectations are way too unrealistic. And with informed consent, it's very important that the patient understands the procedure completely, understands the possible outcomes of the procedure, make sure they have a complete, thorough understanding so that they can give informed consent. And it's very important, as we all know, to act in the patient's best interest. So the patient's input is very important to ensure that the patient fully consents, or if the patient doesn't wish to, it all depends on what the patient's wish and desire is. Here is a question that is a good practice for interviews. For example, we have an answer here. So the question is, should cosmetic surgery be performed for non-medical reasons? And this is what we already said earlier. Cosmetic surgery is not a medically relevant surgery. So should it still be performed? Well, there is no yes or no answer to this, because it's a very complex issue where you have to balance both the patient autonomy as well as the responsibility to avoid harm that is non-maleficence. So we're talking about the two pillars of medical ethics here. On one side, it's very important that the patient has the right to choose what they want to do with their own body, because as we said, it's at the end of the day, the patient's decision. It's in the patient's best interest to do the surgery, and so that choice is theirs. And when we talk about beneficence, it can improve their confidence, it can improve their well-being, it can improve their mental health, how they feel about themselves, how they feel around other people. So this is the good part of it. But when you look at the other side about non-maleficence, it's a very risky procedure. So it's very important to address that, as well as the fact that sometimes surgeries may not address underlying psychological issues, which is a separate field that should be dealt with before undergoing surgery. And in practice, practically, doctors would actually need to first ensure that they have informed consent from the patients to ensure the patient fully consents to surgery, assess their expectations, and consider, as we said multiple times, mental health factors that may be present. So you could say overall, I think cosmetic surgery can be appropriate in some cases, but only when patients are fully informed and carefully assessed. Why fully informed? It's important to understand that they know all the risks of the surgery, to make sure that they have realistic outcomes in mind, and also carefully assessed to ensure why they want to go through this. Is it because they might want to, maybe they might be feeling good about themselves. It's just one feature about them that makes them want to do the surgery, or is it something more psychological? It's very important to assess the patient and what their expectations are. And it's also very important to prioritize the patient well-being rather than just purely aesthetic outcomes, which is why we're also addressing psychological issues and why we said surgeons should screen for any kinds of mental health issues first, because those should be prioritized over just a good aesthetic outcome. Now we're going to look at some interactive scenarios. So it would be very nice if um, all of you could text your answers in the chat so that we could just have a bit of a discussion because some of these are ethical scenarios and ethical dilemmas that could happen in the real world as well. So I will show you the scenario first, and then we will have a small discussion after it to see what things should be considered. So here is the first scenario that you can take a look at. So what it reads is that we have one liver available for transplant. You have two potential candidates who are an equal tissue match. So we have two patients. One of them is a 35-year-old mother of three with a genetic liver condition. And the second patient is a 60-year-old philanthropist who has donated thousands to the hospital, but whose liver failure is due to chronic alcohol substance use. So both of them have problems with their liver and need a liver. The question is, what factors would influence your decision behind who should be the liver recipient? So take a moment to think about this and just please send your answer in the chat about what kind of factors, what medical pillars would you consider, and just overall what would influence you to choose one patient over the other. We can have about 2 minutes just to send your answers. Okay, I see one answer here about age. The 60-year-old is older, therefore they might be more risks involved. That's a good point, actually. We will also talk about that soon. So overall, what you're trying to say is that the surgery might not have as good of an outcome in the older patient as it would in the younger patient. So you could say that we could favor the younger patient since they could lead a better quality of life compared to the older patient, where maybe the liver transplant might not have as big of an effect on their life. So yes, that's actually a very good point. Yep, some really good answers coming in here. I'm just trying to read them. Um, Yes, I see an answer about treating both patients equally, which is a good point actually, because yes, we shouldn't judge the 60-year-old. It's very difficult to actually choose between them, but both of them do have reasons to be chosen. So we can't judge the patient for having an alcoholic problem. They also have the right to access this kind of procedure. And also the 35-year-old mother, yes, she does have children who are dependent on her. So overall, um, there is a greater advantage to choosing her over the other man because she has people who depend on her. And so this could have a good outcome for her family. If you got the new liver, yeah, that's also very similar to what was mentioned earlier as well, because since he could potentially, if he chose to drink alcohol again, maybe, um, the liver would just go to waste, so to say. There would be no point of the surgery because the chance of there being a good outcome could be low. Whereas if you were talking about the mother, she had a genetic condition, and so giving her a normal, healthy liver would mean she would have a normal quality of life from then on. But you cannot say the same about the other man who might continue to pursue alcohol, for example. Beneficence is clear in the fact that yes, that's very true. Both patients will definitely benefit from this. The 60-year-old can live on to continue his work, and the 35-year-old can live with their children. We also need to consider the risks. So definitely, yes, these are some very good answers. Um, is it worth giving the surgery to the person that has more risks? So yes, many of you have said the same point here actually, which is the result, the outcome of the surgery in the long term is if the 60-year-old man maybe could continue to pursue unhealthy life choices. Maybe because he's much older, the chances of the surgery having a positive outcome is lower. This also is a major thing to consider. That's a good point. Patient B's chronic alcohol use, yes, that's also the same point and very good. Um, if he continues to pursue alcohol usage, this could have a bad impact and wouldn't make a difference. But if he got substantial rehabilitation, then that might help his case too. So yes, that's also a very good point. So there is a chance if he continued to pursue alcohol, but then maybe if, like he said, if he were to be put into rehabilitation, maybe the outcome would be much better. So yes, thank you guys for these brilliant answers. I think most of you have actually covered all of the points that need to be said. So we'll just have a little discussion here. So the first thing is consequences, which many of you covered, is what are the consequences on both these patients if they were each to receive the liver? So in terms of longevity, so we talked about a 35-year-old mother and a 60-year-old man. So which would the surgery have a better outcome on in the long term? Well, we can imagine that since the mother is much younger, she only had a genetic liver condition, and so implanting a normal, healthy liver into her would mean that she might not have symptoms anymore in the future, and she could lead a normal quality of life. And effect on the wider family, she has 3 children, so now that she's able to lead a normal quality of life, she could lead a normal life with her family. Her children wouldn't have to deal with losing their mother, deal with that kind of trauma. So overall, on her family, that could lead to a very positive impact. But there's also the point that some patients can wait weeks before receiving the organs. So, what we saw here is we have one liver available for transplant. So, maybe we could possibly choose the patient who desperately needs the liver, who's in more urgent need of the liver, and maybe we can keep the patient waiting who could possibly wait before receiving the organ. So it's not that we would have to choose only one of them because, like one of you said, it's important. Both patients have the right to the surgery. Both patients should be able to receive it, but it is possible that we could prioritize one patient first, and then the patient who could keep waiting could be prioritized later. The clinical aspect as well, which patient is more compatible with the liver. So genetically, which patient would body would accept the liver better, which patient would have fewer side effects with the liver that was transplanted into them, or whether potentially the surgery might turn out more successful in one patient compared to the other. So as many of you said, chances are it might turn out more successful maybe in the mother, but maybe depending on compatibility, it might be more successful in the older man as well. So it's also important to choose which of them it's more compatible with. But also, as many of you have mentioned about circumstantial factors. So if the patients were to continue pursuing unhealthy life choices, so we said the philanthropist had chronic alcohol substance use. So if he were to continue pursuing this kind of a chronic alcohol after getting the liver transplant, would that have a good impact? Would it be better if we choose the mother in this case over him, because we're assessing which person would have a better outcome? If the patient would were to pursue the same choices again, this would just lead to for liver damage once again, and so overall we don't see a point in allowing that patient to undergo. But then again, all patients do deserve to undergo this surgery. And this is only chance because, like one of you said, maybe the patient might undergo rehabilitation, they might get therapy, they might stop using alcohol later on. And so, of course, then it would definitely be vital that the patient gets access to that kind of surgery so that they can have a normal quality of life afterwards, even if they might be older. The number of dependents. So, as we said in the case of the mother who has 3 children, she's also quite young as well, has a good number of years ahead of her in her life. So, would we choose the mother because it might have a better impact not just on her life, but on the lives of the people who are close to her as well. So all of these are different factors that we do take into consideration. But at the end of the day, yes, both of them do deserve equal right and equal access to this kind of surgery. But in terms of choosing who to favor more, these are the different kinds of factors that we take into account. So thank you guys for answering. We do have a couple more scenarios as well, so you can continue to send in your answers. The second one that we have here is Dr. Blair recommends homeopathic medicines to his patients. There is no scientific evidence or widely accepted theory to suggest that these medicines actually work, and he doesn't believe them to either. So he doesn't have proof that this kind of medicine works, but he recommends them to people who have various non-specific mild symptoms, general symptoms like fatigue, headaches, muscle aches, because he believes that these medicines won't do any harm but will give them reassurance. So, what are the ethical problems of Dr. Blair doing this, of recommending a medicine that he doesn't even know would work, that there is no scientific evidence to prove they would work? There is basically no evidence to suggest that the medicine might not have bad side effects either. So what are the issues that you guys think are associated with this kind of behavior? I'll give you guys a couple of minutes. You can please send your answers. Yes, that's a very good point, actually. The patient does not have informed consent because they are not given all the information that's available regarding this type of medicine. So it's very important that they know everything about the medicine before they are prescribed this. So that's a good point. And concerns. Yes, exactly. Actually, regarding the placebo effect, because like most of you have said, although the patient does not have information about the medicine in order to give informed consent, the fact that they might believe it's having a good effect on them could be favored when we talk about beneficence, which is good, doing good to the patient. Exactly, because we don't have any idea whether the medicines work or not, whether they even have a bad side effect or not. So yes, it is very important that we do evaluate that. Yes, so mostly we're talking about beneficence and non-maleficence and informed consent because although the medicine might not have a good impact on the patient and the doctor themselves don't know whether it would have a good impact on the patient, could give them false hope, as we have said. This also is just him trying to help the patient and maybe might make the patient feel like they're feeling better or the patient might feel like the medicine is doing something good. Although he may intend to reassure patients, he recommends treatments that lack evidence since offering exactly. So, yes, that's a very good point actually that you have mentioned here about evidence-based care, which is one of the foundations of medicine is providing treatments that have been proven to work. And so providing treatments that are possibly ineffective, possibly could have bad side effects on the patient is not a good use of medical resources. So it was not a good part of his on his side to prescribe a medicine that wasn't even researched well enough. So yes, brilliant points that you have mentioned. So I'll just quickly go through these points since we are running short on time, and then we'll just do one last scenario before concluding this part. Replacement of proven care. So while some of these remedies might carry certain benefits for specific patients, as we said, might potentially, because they're not researched, even the doctor is not sure about it. But even if they were to have a good impact on the patient, as we saw in beneficence, replacing evidence-based conventional medicines could lead to further disease progression and might lead to more bad than good. And also, since the doctor should be practicing evidence-based care, this is also not right for the doctor to be prescribing medicines that do not have evidence to support that they work. It's also very important to for the doctor to emphasize that these practices of homeopathic medicine do not act in place of entirely curing or preventing disease. And it's also important, as many of you have said, that the patient makes informed consent. So the doctor should be giving the patient sufficient information for them to decide whether this kind of treatment is suitable for them or not, so that the patient can fully decide and consent to taking these kinds of medicines. So yes, most of you have given the right points. We'll just do this last scenario and finish this part. An 18-year-old man is diagnosed to have suspected bacterial meningitis. He refuses any treatment or therapy and he returns to his university accommodation. So it's an infectious disease that he has refused to be treated for. What steps you as a doctor or as a medical student would do in this kind of situation? Yes, that's a good point, actually. Patient autonomy is respecting the patient's decision to not want to tell people, and to not accept treatment for this kind of thing. So yes, as a doctor, it's important that we make them understand what consequences could result in not getting treatment and not letting people know, because this is not just about the patient, but also about the wider community, since it is an infectious disease, and the fact the patient doesn't want to get treated for it, doesn't want to let the people around him know that he has this disease could pose an impact on the wider community that he's surrounded by. So yes, it's very important that we as a doctor fulfill our responsibility of letting them know. But then at the end of the day, it is the patient's decision to not want to accept treatment. Yes, exactly. It's very important to respect the patient's autonomy to not accept treatment. But at the same time, as a doctor, it's our responsibility to practice beneficence, to let them understand the impacts of not accepting treatment, the impacts of not willing to um, get treated for this disease. So yes, it is very important that we try to make them understand, but at the end of the day, yes, it is their decision to refuse care and to not take treatment. Exactly. That's a very important point, actually, that Archita has mentioned about not accepting treatment because even if it is the patient's autonomy, we're talking about an infectious disease that could impact the wider community. Yes, that's a brilliant point, actually. Thank you, everyone, for all the brilliant points that you have mentioned. So let's just quickly go through this. Um, what most of you have mentioned correctly is that it is the patient's decision to choose not to undergo treatment, but also this has a negative impact on the wider community. And so this is where we talk about breaking confidentiality, because when we talk about public interest, it is important to consider that since the patient does not want to accept treatment, they do not want to be treated for this kind of disease, there are many other people who come into contact with the patient and are at risk. So confidentiality might need to be broken in order to reveal to people the patient has this disease to stay away from the patient, even if this is not what the patient wants. So it should be important that we as doctors encourage the patient that they break confidentiality, let people know that they are infected, and if the patient refuses, even after the doctors tell them to, as a doctor's responsibility, we should break confidentiality to any other vulnerable person who might be prone to this kind of disease and might have been in close contact with the patient. So it is very important that we not just act in the interest of the patient, but also the interest of the wider community. But also, once again, if we as a doctor have broken confidentiality, it is important that we keep the patient informed in order to let them know who we've told, what they've been told, so that the patient's also aware. But then this also has a negative side to it. Um, because disclosing this information might cause harm or distress to the patient as well as others around them. So it is very important to also consider ways that we can try and reduce the harm without breaching confidentiality, because if it needs to be broken, we need to assess how much of intrusion is actually required, how much should be revealed, how many people we should be revealing this to, because if we were to reveal to the patient that the doctors have broken confidentiality, this might harm the trust that the patient has in the medical profession, because they might assume that doctors release information, sensitive information, without consent of the patient. So it's also really important to consider that and assess when it needs to be broken, and also the extent to how much is revealed to the people surrounding the patient. So yeah, these are the different factors to consider. Thank you everyone for taking part. I really enjoyed seeing all of your answers. So this is my part for now. We will now move on to the well-being section. Thank you everyone. Have a great evening.
Okay, so now we're going to quickly move on to the mental well-being section. So, how can you manage mental well-being? So, you can do that by looking after how you think and feel. So, kind of just taking a moment to just think about what you've been going through and how and what steps you can take to get there and how to get better, because small actions can make a huge difference. So, making sure that you are taking a step back and reevaluating your mental health is really important. So, what is mental well-being? So, mental well-being is feeling able to cope with daily life. It's also building resilience and balance and staying connected and supported. So, making sure that you are just being able to cope with everyday life and moving forward as best as you can. And mental well-being is about how we think, how we feel, and cope with life. It also includes emotional, psychological, and social health. And looking after it helps us to handle stress and enjoy life. So why is it important? So it helps you cope with challenges. It also improves mood and confidence. It supports physical health, so it makes you actually feel better. And it builds stronger relationships. So you may build better connections with your friends, family, or anyone else around you. So self-care. So self-care means doing things that help you feel relaxed and happy. And examples of these could be listening to music, watching films, going for a walk, or just doing anything that just helps you take your mind off the hard things in life. And self-care is the practice of individuals actively managing their own mental health and well-being through informed actions, habits, and lifestyle choices. So, 5 ways to protect your mental well-being. So you can do this through connecting, so connecting with people that you're close to, being active, so going outside, taking notice, so taking a step back and acknowledging what may be wrong with you, keep learning, so ways to improve your mental health, and giving, so giving and helping other people who may be struggling as well. So focusing more on connecting. So as mentioned previously, you could talk to friends, families, join clubs or societies that could help you take your mind off things and spend time with people that you can connect with and actually open up about with your issues. Moving on to being active, so you can also exercise, and exercise actually improves your mood and reduces stress. And examples of these could be walking, sports, dancing, or just anything that could keep you active and take your mind off of things. And taking notice, so focusing on the present moment, noticing your surroundings and your feelings, and this overall just helps reduce stress. Okay, so maintaining a healthy lifestyle. So these could be things such as eating balanced meals, also getting enough sleep. Sleep is very important for your mental health, and reducing harmful habits, but also being around people as well that do bring good habits for you. So just basically just removing anything that may be harmful for you, including people as well, is very important. Managing your stress. So, managing your stress could include talking to someone you trust. So, anyone who may be in your close circle that you can trust and you can confide into, or anyone from like your school or just all the clubs and societies that you trust, your parents, family members, anyone. You could also identify the stress, the causes of the stress. So, as mentioned previously, with the taking notice point, just taking a step back and realizing what is causing the stress, and then focusing on the positive things. So, ways in which you can improve the stress and active ways in which that you can implement in your life to make sure that you're not feeling stressed anymore. Making time for you. So making time for you is very important. You have to do things that you enjoy, and you shouldn't feel guilty about relaxing. And you should always schedule a me time. And this is very important, especially for us as paramedics. Um, because revising and just always keeping on top of work is really important. And we may also sometimes feel very guilty about relaxing or not revising. So I think, especially now that exam season is approaching, it's really important to know when to stop. And sometimes it's really important to know that we shouldn't be revising at all times and we should take a step back and relax because it's not a bad thing, but it's really important for your mental health. So when to seek help. So it's really important that you should always seek help when it's right and as early as possible. And if you feel overwhelmed or low for a very long time, this could be a sign to ask for help. So you could talk to friends, families, or professionals that you know that you can trust, and just anyone that you know that is able to help you in many different ways. So, conclusion. So, mental well-being matters every day. Small actions do make a big difference, and so building healthy habits over time can really, really help to improve your mental being. And just remembering that you are not alone, and that everyone is able to help you, and that you shouldn't feel alone at any time. Thank you.
Thank you very much, everyone, for the wonderful presentation on the well-being presentation and also the ethics presentation. I hope that you really, really enjoyed it and you found it insightful and informative. Precious has just put on the attendance form as well, so please make sure to fill it. If you want to get the certificate, we do a certificate for every time you attend 5 seminars. So yeah, thank you very much for joining. I think next week we'll also do something ethical based, before we kind of take an organizational break, because it is exam season. And so yeah, I hope that you're enjoying these seminars. And if you have any other questions, I'm sure the presenters and I will stay behind to answer any questions that you may have. But other than that, that's all we have for you this week. I hope you have a great week ahead. And yeah, thank you very much. See you next week.